Welcome back to Tips Over Tea. This is episode 21. I am Nicole, your host. We had the great pleasure of speaking with Jennifer Briggs, who is an acupuncturist. Her focus with acupuncture is pain management. So if you've ever wondered about acupuncture and pain management, I want to encourage you, go grab your tea and listen in. Welcome to episode 21 of Tips Over Tea. I'm so excited to have Jennifer Briggs on with me today. Jennifer, thank you so much for being here with us today.
Thank you for having me. This is a lot of fun.
I'm glad. This 30 minutes is going to go by quick, so I'm going to get right into it. So you are an acupuncturist. You've been in practice for over 20 years, even though you don't look old enough to be able to say that. That's really cool.
Well, thank you. I did start a little young, I guess.
Awesome. So what led you to that career field?
I grew up with a lot of allergies and asthma. And, as a result, I was in and out of the hospital, had doctor's offices, spent some time in an oxygen tent at one point. And I had this background of, taking a lot of medication and visiting the doctor a lot. And so when I was 18, I had a friend who was getting acupuncture. There was one guy in town, and most people thought he was pretty eccentric, but he was getting acupuncture for a head injury. And I was hanging out with him one night and was having this asthma attack. And I was like, I just couldn't breathe. And I was like, you need to take me to the emergency room. My inhaler isn't working. I can't breathe. Like, you need to take me in. And he said, well, why don't you try acupuncture? And I was like, you know what? This doesn't feel like a good time to try anything.
Right.
But he eventually promised me that if it didn't work, that he would take me to the ER. And so I went to the acupuncturist, and he did a treatment on me, and it broke the attack. He gave me some herbs. This particular fellow did only work on the hand, but he said, as he was putting in one of the little needles, that this would release my body's natural cortisone. And being asthmatic, I knew that is the very first thing that they do when you get to the emergency room with an asthma attack, is give a shot of synthetic cortisone to open up the airways. And I was like, well, it hadn't occurred to me that the cortisone should be in my body, although I had, enough biology and stuff by that point that, it just hadn't occurred to me that actually the substances that my body needed were already there, but there was just something happening that either they weren't being produced, and that there was some way that you could then stimulate that. I thought that was a much better solution, because the thing about those medications is that most of them are kind of like uppers. So I would take them and I would get really jittery and be hard to sleep, and I just would be full of this just energy that was I just didn't like them. And then the allergy stuff never did seem to work. My nose was always just full of phlegm anyway. So this idea that there was something else that I could do was really appealing to me. And I was at that point old enough that I was kind of starting on my career path. And, I just kind of kept thinking about that for 4 years. And then when it came time to decide, what is my next step after college going to be, I decided that would be a good direction for me.
Yeah. That I would say, yes, that would motivate me. Wait, I don't have to put synthetic at my body. Okay. Yeah. I need to teach more people. I need to help more people with that. Yeah.
Yeah, definitely.
I love it. So in your clinic right now, do you focus on where is your primary focus, or what are some things that you treat most frequently?
So, the primary focus of my clinic actually is pain management.
Okay.
I did work for insurance company for years and years. So it was kind of as a matter of practicality, but also, treating pain has always appealed to me. My next door neighbor growing up was a surgeon, and then my pediatrician lived down the street from us. So this idea that like when my sister fell, it like drove her Hot Wheels down the back steps, like the full flight of stairs, and broke her arm,
Right.
and got a concussion. And the idea that like the first thing that my parents did was go next door and see if Dr. Vanderheiden was there, and like he would come and oh, that arm definitely is broken, like take her in, you know what I mean? So like this idea that that doctors were people who had a body of knowledge that was like immediately practical, and just was really appealing to me. So the pain management really was a natural fit for me. If you had asked me when I was 15, I would have said that I was going to be an orthopedic surgeon. Clearly, I had no idea what orthopedic surgery was. Like, I do not use power tools, and and I don't do construction. So, so I always actually like to think that the work that I wanted to do when I was 15 is actually like the work that I get to do with acupuncture and pain management. I work a lot with trigger points and, helping restore normal motion of joints, which can really help in conditions of arthritis and things that Western medicine doesn't really have such good tools to deal with. So
Yeah, range of motion is huge. Like when you lose it, you really miss it.
it's true. And there's this like kind of cascading effect in the body where if one joint isn't working right, then the joints on either side are then at risk of injury themselves, or certainly at risk of dysfunction, and the injury can come with time. So, really appreciating that, like, it's not just your knee or it's not just your hip. If it's your hip, you got to look at the knee and you got to look at the back. So
I always found that interesting when I think I had like lower back pain. Of course, one of the things you look at is the strength of your abdominal muscles, but also someone was saying to look at my Achilles tendon, or just, I was like, it's so weird how we don't think about how everything really is connected. So I found that fascinating. If you have low back pain, maybe roll out your your calves or something like that.
Right. Yeah. How I explain it to people a lot of times is that the connective tissue in our body is like a 3-dimensional net. And then like all of the structures that are inside of our body are like, sort of contained in that net. And the net goes through them. And so, when we work, there were in the example that you gave, there was something around that calf area, that Achilles tendon, that like there was a knot in the net, and that knot was pulling all the way through. So, it's not, I don't know. I just like that image, because I think you can kind of, like you start pulling the strings on the net and be like, oh, where's that going to go?
I like that. It's like undoing yarn. You're like, where?
Exactly. Yes. Yes.
Not that me and knitting do not go well together, but I do like the yarn, the way the yarn just like rolls, and yarn is
I could untangle yarn for like hours and hours. I find it so soothing.
It is.
But like, don't give me a puzzle. I hate puzzles. I really don't like them, but I can untangle yarn. So just
Random.
funny, how different
Yeah.
things are appealing to different people.
Yep. Yep.
So
Random. I love random stuff. Awesome. So, pain management. What would you say to somebody if they are in pain? Would your clinic be a first place to start, or would they go to their doctor first? Do they get referrals? How, just in case someone watches this later and they're like, I have pain in wherever, where should I start the process?
yeah, so part of it has to do with severity. I really don't want broken legs showing up. They're very painful, but this is not the place to come.
Makes sense.
So, in the case of a broken leg, definitely go to the doctor first, get it treated, get it, get it stabilized. Then you can come in and I'm happy to work on it. In the case of like older injuries that might have become chronic, that my clinic is a very good place to go. For the cases of pain where Western medicine either doesn't have direct treatment for it, something like arthritis, where the main thing that Western medicine can do is say like, oh, take ibuprofen. That is a perfect case for somebody to come in. Because we don't have to take the ibuprofen. And if we can get that joint range of motion back a little more, or, there's lots of things that contribute to an arthritic joint, but we can definitely do we have more tools than take ibuprofen.
Yeah.
And then the last case that I can think of is, the cases where Western medicine just isn't sure what the problem is, kind of fibromyalgia type of cases, or cases where people are just having like random pain, or like just random pain that doesn't have much, like there's nothing to really like treat as far as Western medicine goes. So,
like fibromyalgia.
Yeah.
It's just like
scar
that.
tissue is another place that another place where my clinic really can help. Sometimes after surgery, the scar tissue gets cut. Oh, it does all kinds of weird things in the body, but and sometimes I know they do go in and surgically like release scar tissue, which is, really, really helpful for people. If, they don't always want to do that unless it's really, really severe. But, even just a little bit of restriction in that scar tissue can cause problems.
Yeah, it could prevent range of motion a lot.
Yeah, definitely. Or like I had one woman come in who had nerve entrapment through, she had like 7 or 8 surgeries on her abdomen. I mean, the scar tissue was really impressive. And I feel like it takes a lot to impress me, but it was, this nerve would like kind of in the front of her abdomen would like fire sometimes. And she said that she would just like have to like jump up like wherever she was and like scream, like in the middle of meetings at work and that kind of thing. And so I have this one tool, which is magnetic pens that are good for helping release scar tissue to a certain extent, but opening up that area but I think I treated her twice. And then she went to Disneyland and I never heard from her again. So
must be good.
After the first treatment, she said that like it hadn't stabbed her like during her work day. I think she maybe like had like where she had been having like 3 or 4 stabs every single day. it had only like for in a whole week, she had maybe only had like a couple of episodes of that.
Nice.
So, you know,
Yeah.
and it doesn't, everybody's different with how they react, but it's, you know, cases like that, that makes a big difference to her. She didn't have to have another surgery for one thing.
Right.
You know?
Right. And I can imagine how disruptive that would be if you're driving or in the middle of a meeting like that.
I think she worked at a bank or something
Oh
like
my.
that. But I was like, oh,
it could be scary.
I know.
Like emotion, because you know, in the bank, if you have like all of a sudden this loud noise, you're like,
right,
that can be,
right, you know, or you know, she's working with a client or something.
Yeah, that would not be helpful.
That's bad. Nobody wants that.
Right. That is definitely, I would say that's debilitating in a way, right? Like
absolutely disruptive, to say
disruptive. That's a better word. I like that word.
Yeah.
Awesome. Where are you located again? Just because you see
my clinic is in Coos Bay, Oregon, and I have plans to expand outside of this area. You know, hopefully within the next year or two. So you could look for Briggs Health, but I might rename it. So we'll have to see. I'll keep you posted, though.
I appreciate that. And you have a website, right?
I do. Yes, it's briggshealth.com.
Okay. So in the description, after we're done with this, I will have that there. And then if anything ever changes, I will update the description so that people can continue to find you if they catch this like in a couple years.
Right. Yeah.
I mean, an acupuncturist, where can I go?
Yeah, so, I really appreciate it.
Yeah, of course.
So can I talk about one of the other real areas of interest that I have?
Please do.
Okay, cool. I discovered several years ago, like almost a decade ago now, that that what I had been eating, I've played with my diet a lot over the years, and I had a friend suggest a very particular diet for me. And I was amazed. I mentioned that I had that asthma. So one of my sort of disappointments with Chinese medicine was that I, you know, still kind of needed to use my Western medicine inhalers, and sometimes even like the stronger drugs sometimes. Because the asthma was still there, and the allergies were, you know, it kind of came and went depending on where I lived. But when I moved back here to Coos Bay, this is where I grew up. They came back just like, you know, I had never been gone. And like the kind of allergies that, like, you know, my nose was stuffy all the time. So then when I would get sick and would get even stuffier, like I would bend over and like there would be snot dripping out my nose. So, you know, I was actually wearing masks before it was like necessary because on those days, you know, I would literally have to put a mask over so that I would not be dripping on my patients.
Yeah.
You know, and people were understanding. I always called myself the scary surgical mask lady, so I went to do the session with my friend, and he suggested, he's an acupuncturist down in Santa Fe, New Mexico, where I went to school.
Okay.
And he suggested that I modify my diet in a particular way that was based on muscle testing. So he muscle tested this for me, and he said, okay, so you got to do this, 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 and this. And I was like, oh, that's a lot. But also it was enough of a change from what I had been eating that I was kind of like, well, I just have to rethink like all my meals. So, you know, like I can, you know, just go ahead and charge ahead and do it. And I was amazed because within about 2 weeks, I was seeing improvement in the asthma symptoms to where like I have the exercise induced asthma. And so if I'm outside walking, especially up a hill, so there's this great big hill, and I was at this party it was cold out, it was Halloween night. And I walked up the big hill. I started getting kind of wheezy.
Mm-hmm.
And then I got to the top, back to the party. And ordinarily that would have lasted the rest of the evening until I went home and got my inhaler.
Mm-hmm.
But that particular evening, after like 3 or 4 minutes of being inside the house again, I was actually like totally fine. Like nothing had ever happened.
Nice.
And, like all these symptoms just kept getting better and better. Like one of the other things that I always had was kind of like chronic diarrhea.
Mm-hmm.
And like, like to where I would have to get up in the middle of a meal, sometimes at a restaurant, and like go find the bathroom. Or like after dinner, or like every night, I would have to go to the bathroom right away, like before I would clean up. I would pass out after dinner too. I just like be so tired. I can't even like food coma like every single night.
Yeah.
And that stopped happening. So it really, I mean, like that was, to me, was profound and amazing, on the same order of, this spot will release your body's natural cortisone. I've kind of over time like worked with it, and I've got a program that I'm still kind of tweaking, but I've done it with several people. And when people can really dial in what is good for them to eat, I mean, the inflammation system-wide goes down. You don't always think of like our moods being related to inflammation, but they totally are.
Yes.
Anxiety, depression, those are things that we experience, but they are also happening in our physical brains, in our nervous systems. So, just the potential of this is, I mean, it's amazing.
And gut health is huge. It's
gut health, but also it goes beyond gut health.
Okay.
I think maybe it doesn't. I feel like I still have so many questions about this.
Yeah.
But I feel like it goes beyond gut health, because what it feels like to me is everybody has things that they should and shouldn't eat. Like my sister has always hated mushrooms. She won't eat them. She thinks they're like, I love mushrooms. I think they are delicious, golden. I could almost eat them every day. She won't touch them with a 10-foot pole. I guess I would be surprised if it was something in her gut exactly that was giving her that, like message, don't go here. Do you know what I mean?
Yep.
Or like, is it true that everyone should really be able to eat dairy?
Right.
Like, maybe yes, in theory, maybe no. Do you know what I mean? So it feels like there's some parts of this that go beyond just gut health, and maybe, kind of like constitutionally determined almost, like genetic or epigenetic. But I don't know. I feel like there's a PhD there.
Go for it.
Right.
Yeah.
No, I in reality, I feel like there's a lot of study, to be done in that area, and
yeah, there's been a lot but there's still a lot more to go, which I find extremely fascinating.
It is. It's so interesting, the microbiomes.
Yeah.
It's good stuff.
It is.
Enzymes. Like one time I tried to, was doing some research to see if I could figure out where phlegm came from, right? Because I had so much phlegm. And phlegm is like just amazing. Like, how could there be so much of it? And like, it was surprisingly difficult to find out like where phlegm is made in the body. Like, it's made in the gut a little bit, but it's like, it really wasn't clear.
It's interesting.
It is. And just things like that.
I feel like you're going to find out for us, and we'll have to have you back on the show, and we have a whole nother conversation.
Right. Well, thanks for letting me talk about that a little bit.
Hey, no worries. No, that's exciting. That's wonderful stuff. And it couples very well with what you are currently doing. So
yeah,
you'll definitely have to come back and share once you get more into that part of it.
I know.
Yeah. So we have just a couple minutes left. So I always like to use this time to ask if there's anything you've got going on, like anything virtual, because right now you're seeing people in person. There's not really, you don't have a virtual component to your shop, do you?
No, not exactly. I do the program that I run for kind of helping people work through some of their diet stuff and kind of dialing in their diets. That is an online program.
Okay.
I haven't completely launched it yet. But as I free up time, that is one of the things that would really like to, put some time into. I am hiring acupuncturists and am looking forward to doing so for the foreseeable future. So, for anybody who's in the field, who really loves the medicine and wants to practice without having just all the stuff that goes into owning your own practice. Boy, when I graduated Chinese medicine school, there were no jobs at all. I would have killed for a job. I would have. I was like, oh man, all that time. And it's really, such a fun kind of medicine to practice and interesting. And, so one of the things that I would really like to do for the field is to make it so that people, know that there are jobs after acupuncture school.
Yeah. Yeah.
So as I, build that business and, go into the virtual, the programs, I just feel like I'm really excited to have these things starting to grow.
Absolutely.
People,
Yep. That's why we get started into doing these things that we do.
Yeah, it's so true.
Yeah. So when you do have it live, you could just add the comment on the YouTube channel, because you get notifications when there's a comment. So anybody who's liked and subscribed, they should get a notification for that.
Oh, that's great. Yes.
Yeah. So just keep us posted on that. Other than that, do you have any last tips for anyone looking or thinking about an acupuncturist for pain management? What should they look for maybe in a clinic, like experience-wise? What questions any frequently asked questions that you think someone may ask? Just one or two questions that you could think of to make sure they're with a legit acupuncturist.
I have people ask me a lot, what, like they'll say, I want to go to a chiropractor, but I'm not sure who to go to. Right. And what I always tell them is call the office and just give them like a super short explanation of your problem. And they will tell you if it's something that they, can treat, or if it is something that is outside of their box. So, like when people come to me for certain, sometimes when people come in and they really want to get pregnant or something like that, fertility stuff, I can do it, but I know that there is a clinic, not too far away that also does that, and they more specialize in it.
Yeah.
So do you know what I mean?
Yeah. So just make some calls and ask.
Yeah. Just have your explanation of your condition be super, kind of in 2 sentences. and they will tell you.
Mm-hmm. Awesome. I love it. Easy peasy.
Yeah. Yeah.
Well,
Ask.
Jennifer,
Just ask.
I love it. That is a simple way. You can't forget that. Awesome. Well, I thank you so much for hanging out with me. I told you 30 minutes just flies by. I don't
It
know
really
how
does.
it happens.
Yeah.
So thank you so much for your time. I
Thanks,
really
Nikki.
appreciate you being here. You're so welcome.
Yeah,
And
you're doing great work.
oh, thank you. Thank you.
Mhm.
I received that.
Yay.
Yay. Thank you everyone for tuning in to episode 21. I hope you got some really good nuggets just listening to Jennifer and her expertise. If you have any questions, feel free to just post in the comments below. We'll get notified. If she doesn't catch it, I will reach out to her on your behalf and let her know that you shared a comment and she can reach back out to you. Other than that, make sure you like, subscribe to the channel, click the bell so that you'll know anytime we upload a new video or have a live video. And until then, we'll see you next time. Ciao, everyone. Hey, thanks for hanging out with us today. Make sure you like, subscribe, and click the bell so that you'll be notified anytime we upload a new video. And if you have any questions, don't hesitate to put it below. We'll definitely be checking the comments and respond as soon as we can.